Thanks for agreeing to tell us about your experience here at Twin Creeks. So you came in about 3 months ago, I think, correct?
July.
In July. And why don't you tell us a little bit about how you were feeling then?
Okay, so when I came in, I was at the max of my pain level. I did not sleep, maybe 2 hours a night, and that was spaced out. I could not sit down, and I could not lay down without pain. So I stood all the time.
Right. I remember you even coming in the office and just standing. So how did this all start for you?
It started in January with I noticed when I stood up I had a sharp pain on my left side, and it just got progressively worse. I went the medical route and had a steroid injection. That made me significantly worse.
Okay. So you had an MRI. When did you have the MRI?
In May.
In May. And it was L5, huge, big, gigantic bulging disc.
Yes.
Yeah.
Yes.
That was sitting on the nerve root for your sciatic nerve.
Yes.
And then you had a steroid injection
In June.
In June.
Very beginning of June.
And it made it a lot worse.
Yes.
Okay. And then so you guys, how did you find out about us?
So we used to be up in the middle of the night and all the time. And it was a night where I was pacing around and we found you on the internet. And it was just a Google search of horrible back pain, what can we do? And you guys popped up.
Oh, funny. So we looked at you and we saw the disc bulging and decided to do the decompression, which I know was a hard decision for you guys.
It was.
Yeah. And I because it was such a big disc, we made it for a little bit longer than my normal treatment plans. So now we've been finished for about a month.
Yeah.
3 weeks, a month. How are you feeling now?
So as you can see, I'm sitting down.
Right.
I can sit. I sleep all night with no problem. I had significant numbing in my leg and feet or foot, and that is gone. I am off all pain medication.
What you were taking a lot of?
I was taking a lot of pain medication, and that's gone. So I am feeling more back to my life. Where I was completely isolated. I pretty much just stayed home because it was too painful.
5?
I have 5 children.
5 children. So,
Yes.
I mean, you have a busy life.
I
So
do.
I can't even imagine trying to do that as a mom and feeling the way you were feeling.
It was very hard.
Yeah.
It was a really hard season, for sure.
Yeah. And so, like I told you, with decompression, people tend to get better after we stop for a period of 5 or 6 months. So you have a lot to look forward to.
That's great.
Yeah. So great. Any parting words? Anything you'd like to share?
I would say if you're on the fence to try. Surgery terrified me. The thought of instant pain relief was tempting, but I knew that could cause problems down the road with more weakness in the disc and bones and stuff. And so it seems a little bit like, oh, will that actually work? And it actually works. So it was, my husband said the word, he said, he's either the best con artist I've ever met on selling this, or I really, really trust him. And we really, really trusted you.
Oh,
and
thank you.
You didn't let us down.
How did you like all of our staff, and how did everybody treat you?
Fantastic. The fact that you have gone through decompression and Leslie had gone through decompression was pivotal to me because you knew exactly what I was feeling. It wasn't like you were like, oh, well, try this. I've never experienced it, so I don't know how it's going to work.
Right. Yeah.
You knew how it was going to work, and so that was big selling point to me, and it was very reassuring with Leslie to be like, I'm feeling this. Oh, okay, I know exactly what you're feeling.
Right.
It's going to do this and this. Oh, okay. So that was really, really good.
Yeah.
Really good.
Well, thanks for sharing the story. We appreciate
Absolutely.
it.